Hi, so my presentation is on hallucinogens, and my name is Anna Ismail. So, briefly going over the table of contents. First, I'll be going over what mental wellness is. Next, I'll dive into hallucinogens. Yes, there is more to it than just mushrooms. Third, I'll be going over the debate, which is going to discuss the pros, cons, potential dangers of taking hallucinogens for mental wellness. And fourth, the why behind the madness is why I elected the topic that I did. So, mental wellness is defined as the general feelings and attitudes that you feel in regards to yourself and your life. So, this will be particularly focused on purpose, satisfaction, and positivity in life. Mental wellness is very important because it helps with feeling a sense of belonging, handling stress, and making healthy life choices that in turn continuously affect mental wellness. So, hallucinogens, so what they are is a very large and diverse class of psychoactive drugs that may produce altered states of consciousness. So, this is usually characterized by alterations in thought, mood, perception, and the most common reasons so far of why people take them are religion, spiritual practices, and the overall euphoric feelings. The method that I'm going to introduce today is going to be for mental wellness. So as always, there's always a biological standpoint as to why drugs work the way that they do. Hallucinogens in particular are going to focus and interact with G protein coupled receptors. And monoamine transporters are interacted with by like MDMA, cocaine, amphetamines, and ion channels are more of ketamine, nicotine, alcohol, etc. Of all of the U.S. inhabitants, about 5,500,000 have used hallucinogens thus far. So as always, there's different categories and types. So there are 5 overall types of psychedelics, aka hallucinogens. The first kind is going to be LSD, which may come in the form of a blotting paper, gelatin tablets, or even capsules. Mescaline comes from the peyote cactus, and will usually come in white powder or some form of capsule. DMT comes in a plant form or a white powder. Again, plant becomes the white powder. Psilocybin, which is mushrooms, comes either as a dried mushroom or may come in the form of a capsule. Ayahuasca is from the plant itself, and will usually come in a tea or paste form of some sort. So the ongoing debate is going to be the pros and cons, whether or not it's actually worth it to take hallucinogens for mental wellness. So a few of the pros are chronic pain relief, relaxation, cluster headache relief, PTSD relief. So PTSD is post-traumatic stress disorder, mood disorder alleviation, assistance with substance use disorders, anxiety, and OCD. A few of the cons, because there's always going to be cons, are going to include panic, paranoia, muscle spasms, possible loss of coordination, as well as aggressive and risky hostile behavior. This may not just be towards their peers or others surrounding. This may also be towards themselves. So participating in unhealthy sex choices, such as like having unsafe sex with strangers. But this may also include psychosis. So psychosis is when people lose sense of reality and sense of control. All right, so a few of those reactions may seem a little alarming. So those are considered adverse drug reactions, and there are 2 types of reactions. There are short-term reactions, which last the duration that the body takes to metabolize the drug itself. And then there are long-term reactions, which are usually longer than just the metabolization of the drug and can last for months up to years. So we have psychosis and paranoia in the short term. We also see psychosis again in the long term, as it can last for a little bit longer than just the metabolization of the drug. We also have suicidal thoughts or ideation, which can be very alarming to some. And we also have HPPD, which is a very rare, but it is a clinical disorder defined by 2 weeks to longer of mental hallucinations and more. So a few best practices in terms of it being administered as a medication would be for patients to talk openly with their doctors, making sure that they are notating any symptoms, any effects, whether positive or negative in their life. For professionals, there may be a very concerning effect with society in terms of prescribing something that may seem very experimental. So just making sure that they're going through with thorough evaluations and follow-ups. In terms of systems, realizing that there may not be a one-size-fits-all for this type of drug is going to be ideal in order to figure out what works best for each person. Definitely making sure that we're taking accurate weight and height measurements, because a lot of these drugs will interact based on weight. So finding that proper dosage. For society, basically not allowing ourselves to stigmatize and outcast those that are just seeking relief from some form of ailment, considering all of the pros that we did see for hallucinogens. So the why behind the madness. I included a little diagram over here to the right of like what kind of hallucinogens there are, as well as a harm to user score. Obviously, heroin, meth, alcohol, cocaine, ketamine, THC all tend to gear towards slightly higher harm to user score. But if you see MDMA, LSD, and psilocybin are very low on the totem pole. So I feel like while society would like me to be opposed to the introduction of hallucinogens to the medication market, I believe that these side effects are much smaller and less dangerous than the labels on mainstream opioids and opiates. So the questions that I had set out for the class, my first one was, what are potential dangers of introducing hallucinogens as a prescribed medication? If your parent were prescribed a hallucinogen as a medication, what would your thoughts be? And then, do you believe the benefits outweigh the risk in terms of administering hallucinogens as prescription medications? And then last but not least, here are the list of my resources. If you have any questions, comments, or concerns, you can go ahead and leave those in the comments to the YouTube video. I will try to do my best to reach those. Thank you.